Hello, my friends. I'm Dr. Linda Parker. I'd like to ask you something personal. Have you ever found yourself sitting in a doctor's office, listening to a list of tests being ordered for you, and a quiet little voice in your head asks, "Do I really need all of this?" For so many of us, we've been taught to trust the process, to believe that every test is a step toward better health. It's a belief we all want to hold on to. But here is the nightmare that no one talks about. There are 5 medical tests routinely ordered for seniors over 70 that could be silently pushing you down a road of unnecessary complications. A shocking study revealed that 91% of doctors never have an honest conversation about the real risks versus the benefits with their elderly patients. What you believe is protecting your health could actually be the very thing that harms it. But I am here today to tell you that this does not have to be your story. As a geriatric urologist with over 25 years of experience, I have seen the heartbreaking truth of what overdiagnosis and overtreatment can do. This isn't just theory from a textbook. I'm talking about real people. I'm talking about my patient, Robert, a wonderful 78-year-old gentleman whose golden years were nearly ruined by a routine test that led to a severe infection and a recommendation for a life-altering surgery he never needed. His story is a wake-up call for us all. In this video, I am not here to scare you. I am here to arm you with knowledge. We are going to walk through each of these 5 potentially harmful tests, one by one. I will explain, in simple terms, why they can be dangerous at this stage of life, and I will give you the exact questions to ask your doctor to protect yourself. And please, make sure you stick around until the end. I will be sharing 3 critical questions that everyone over 70 must ask before any medical test. The information in that final section might just save a life. It could even be yours. Before we dive in, I truly want to know how many of you have faced this. If what I just shared feels familiar, please comment a simple yes below. It shows me you understand, and it shows others in our community that they are not alone. Okay, let's get started. Alright, let's begin with the medical test to question number 1. PSA screening for prostate cancer after age 75. For gentlemen watching, this is likely the single most overused and misunderstood test in senior healthcare, and it's a perfect example of how good intentions can lead to devastating harm. The test itself is simple. A quick blood draw to measure something called prostate-specific antigen. But the path it can send you down is anything but simple. When that PSA number comes back even slightly elevated, the standard protocol kicks in, almost like a machine. The next step is a prostate biopsy. This is not a comfortable procedure. It involves taking multiple small tissue samples from the prostate, and it carries very real risks of its own. Risks of significant pain, bleeding, and serious infections that can land a man in the hospital. I have seen it happen many, many times. But here is the most important part to understand. The core reason why this becomes so dangerous after 75. As a man ages, his prostate naturally changes. Furthermore, if prostate cancer develops in these later years, it is almost always incredibly slow-growing. I've often described it to my patients as being more like a turtle than a tiger. It is a cancer you are overwhelmingly more likely to die with from some other natural cause like heart disease or old age, rather than die from. Yet, the discovery of this slow-moving cancer often triggers a cascade of aggressive treatments, radical surgery to remove the prostate, or rounds of radiation. Both of these treatments come with a very high price, a near certainty of permanent side effects like total urinary incontinence and erectile dysfunction. Think about what that really means. Imagine trading your final, precious, healthy years, the years you want to spend traveling, playing with your grandchildren, enjoying intimacy with your partner, for a life dictated by diapers, pads, and the loss of a fundamental part of your manhood. All of this, to treat a turtle that was never going to win the race against your natural lifespan anyway. This isn't just my opinion. The United States Preventive Services Task Force, one of the most respected guideline-setting bodies, explicitly recommends against routine PSA screening for men over 70 for this very reason. Their research shows the harms outweigh the benefits. And a landmark study published in the prestigious medical journal JAMA, which followed over 76,000 men, found that PSA screening in this age group showed absolutely zero mortality benefit. It did not help men live one day longer, but it did cause significant harm through overdiagnosis and overtreatment. This brings me back to my patient, Robert, the 78-year-old gentleman I mentioned earlier. His story is the human face of these statistics. He went for his annual physical, and his doctor, following standard protocol, ordered a PSA test. It came back just a little high. That led to the biopsy, which unfortunately gave him a severe infection that put him in the hospital for a week. The biopsy found a small, low-grade, slow-growing cancer. His urologist immediately recommended surgery. Robert was terrified. He and his wife came to see me for a second opinion, and we sat down and had a real conversation. We didn't just talk about cancer cells. We talked about his life. He loved to fish, and he loved to work in his garden. His life expectancy, based on his overall excellent health, was about another 8 to 10 years. The cancer he had, it would likely take 15, maybe 20 years, to ever cause a single symptom. The surgery would have guaranteed him a miserable final decade. He chose active surveillance instead, which means doing nothing but watching. I saw him just a few months ago. He's 83 now, still driving himself to the lake, and the cancer has not changed at all. He chose quality of life. So please, instead of automatically agreeing to this test, I urge you to ask your doctor these critical questions. Given my age and my overall health, what is my real life expectancy? And am I more likely to die with this cancer, or from it? What are the specific harms and complication rates for the biopsy and the treatments you are recommending? If you believe, as I do, that quality of life is the ultimate goal, please take a moment to comment on the word quality below. Now, let's move on to the medical test to question number 2. Routine colonoscopy after age 75. I want to be very clear. A colonoscopy is an incredibly valuable, life-saving tool for screening for colon cancer in middle-aged adults. It has saved countless lives. However, the balance of risk versus benefit shifts dramatically as we get older, especially for those over 75 who have had previous screenings that came back normal. The procedure itself, which is quite invasive, carries significantly higher risks for an older body. As we age, the wall of the colon can become thinner and less flexible. This means the risk of a perforation, which is a tear or a hole in the colon during the procedure, is 3 to 4 times higher in patients over 75 than in someone who is 55. A perforation is a medical emergency that requires major surgery to repair and can be fatal. Furthermore, we cannot forget the risks of sedation or anesthesia required for the procedure. An older heart and older lungs simply have less reserve, making complications from anesthesia more common and more severe. But the risk isn't just during the procedure itself. The preparation for a colonoscopy, which involves drinking a large volume of a powerful laxative solution, can be incredibly taxing on an older person. It's designed to completely clean out your system, but in doing so, it can cause severe dehydration and electrolyte imbalances. I've had many older patients tell me that the prep was the hardest part. They felt weak, dizzy, and utterly exhausted for days afterward. For a senior who may already be a bit frail, this level of physical stress can be enough to cause a fall or lead to a state of confusion and disorientation. The core reason we must question this test is that if you've had regular colonoscopies in your 50s and 60s and they were all clear, the likelihood of you suddenly developing an aggressive, life-threatening colon cancer in your late 70s or 80s is incredibly small. Polyps, the small growths that can turn into cancer, generally take many, many years to develop. The screening you did earlier in life has likely already done its job by removing any concerning polyps. This is why the American College of Physicians, another leading medical organization, now formally recommends against routine screening colonoscopy in average-risk adults over 75 who have had previous negative screenings. The math simply doesn't add up. You are taking on a very real, immediate, and elevated risk from the procedure itself for a very, very small potential benefit. Why risk a life-threatening complication today to screen for a cancer that you have a very low probability of developing and that would likely take more than a decade to become a problem? Before you agree to another routine colonoscopy, have this conversation with your doctor. Ask them directly. Given that my previous colonoscopies were normal, what is my actual statistical risk of developing colon cancer that would affect my lifespan? What are the specific complication rates for this procedure at my age and at this facility? Are there any less invasive alternatives we could consider, like the newer stool-based tests? Your health is not a checklist. It's a conversation. For the ladies in our community, let's talk about medical tests to question number 3. Routine mammogram screening after age 75. Much like the conversation we just had about prostate cancer, the issue with routine mammograms in very elderly women comes down to the high risk of overdiagnosis and overtreatment. The science is showing us that many of the breast cancers found in women in their late 70s, 80s, and beyond are so slow-growing that they would never have caused any symptoms or problems during the woman's remaining natural lifespan. The mammogram is incredibly effective at finding these cancers. The problem is, it finds too many of them. It finds the tigers, but it also finds a whole lot of turtles. And once a cancer is found, it creates enormous pressure to do something about it. This leads to a cascade of interventions that can be particularly brutal on an older woman's body and spirit. First, there's the anxiety and stress of the finding itself, followed by biopsies, which can be painful and cause bruising or bleeding. Then, if a slow-growing cancer is confirmed, the treatment options are harsh. They can include surgery, like a lumpectomy or mastectomy, followed by weeks of radiation therapy that leaves you feeling exhausted and can burn the skin. For other types, it could involve chemotherapy or hormone-blocking drugs that come with a host of side effects that dramatically reduce a person's quality of life. Think about it. Feeling nauseous, losing your hair, feeling profound fatigue, all to treat a cancer that was, in all likelihood, never going to hurt you. The crucial question we must ask ourselves is this: will finding and treating this disease actually improve the length or the quality of my life? For many women over 75, the evidence suggests the answer is no. A landmark study published in JAMA Internal Medicine looked at this exact issue. It found that while mammograms in this age group did detect many cancers, treating them did not actually improve survival rates. It didn't help women live longer. Instead, it led to a significant number of women undergoing surgeries and treatments that reduced their quality of life without extending it. The harm wasn't just the anxiety of a false positive, it was the very real, physical damage from treating these slow-growing cancers that posed no real threat. The treatment, in effect, was worse than the disease. Imagine being 80 years old, feeling well, and enjoying your life. A routine mammogram finds a small, slow-growing tumor. The subsequent treatment leaves you so weak and tired that you can no longer work in your garden or have the energy to play with your great-grandchildren. You may have treated the cancer, but at what cost? You've sacrificed the very quality of life you were trying to preserve. This is a deeply personal decision, and I am not saying no woman over 75 should ever get a mammogram. But it should not be an automatic, routine procedure. It should be a thoughtful conversation. Ask your doctor, considering my overall health, what is my realistic life expectancy? If a slow-growing cancer is found, would treating it actually extend my life, or would it just reduce my quality of life? What does the evidence really show for women my age? Does this information surprise you? If it does, let me know by commenting the word "surprised" below. Alright, let's discuss the medical test for question number 4. This one isn't about finding a new disease, but about managing an existing one. Aggressive diabetes screening and aiming for tight glucose control in frail elderly patients. For those of you living with diabetes, you've likely had it drilled into your head for years that lower numbers are always better. You've been told to aim for a perfect hemoglobin A1C. That's the blood test that measures your average blood sugar over 3 months, of under 7.0. While that is an appropriate target for a healthy 50 or 60-year-old, for an older adult who may be more frail or have other health conditions, pursuing that same low number can be incredibly dangerous. In fact, it can be deadly. The primary danger comes from using high doses of insulin or other diabetes medications to force those blood sugar numbers down. This aggressive approach dramatically increases the risk of a condition called hypoglycemia. Hypoglycemia is when your blood sugar drops too low. For an older person, this is a medical crisis. The symptoms can come on suddenly. You might feel shaky, sweaty, or dizzy. You can become profoundly confused or disoriented. I've had patients whose families thought they were having a stroke, when in fact their blood sugar had just plummeted. And most dangerously, severe hypoglycemia can lead to loss of consciousness and falls. A fall for a senior is a life-changing event. A broken hip can be the beginning of a rapid decline in independence and health. The terrible irony is that in the quest to prevent the long-term complications of diabetes that might happen 10 or 20 years down the road, doctors can sometimes prescribe treatments that cause a catastrophic, life-altering event today. The core reason this approach needs to be re-evaluated in seniors is that an aging body simply doesn't process medications or regulate blood sugar with the same efficiency as a younger body. The metabolic reserves are lower. The long-term benefits of tight glucose control, like preventing kidney or eye problems decades later, become less relevant for a person with a more limited life expectancy. The immediate, present-day risk of a dangerous fall or hospitalization from low blood sugar far outweighs those theoretical future benefits. Recognizing this danger, the American Diabetes Association has actually changed its official guidelines. They now recommend more relaxed glucose targets for many older adults, especially those with multiple health issues or limited life expectancy. An A1C target of 7.5, 8.0, or even 8.5 is now considered not only appropriate but safer for many seniors. Yet, I still see so many doctors aggressively treating their elderly patients to chase that old target of 7.0, causing dangerous complications in the process. This is where you must become your own advocate. If you are being treated for diabetes, talk to your doctor about your personal A1C goal. Ask them these questions. Given my age and my overall health, what is the safest blood sugar target for me, specifically? What are the risks of hypoglycemia with my current medication plan? Would a more relaxed target actually be safer and provide me a better quality of life? It is not about letting diabetes run wild. It's about finding a wise, safe balance that keeps you healthy and on your feet today. Finally, let's cover medical tests to question number 5. Routine cancer screening with CT scans and other extensive imaging. This is a growing trend I've seen that deeply concerns me. Sometimes a well-meaning doctor, perhaps during an annual physical for an elderly patient, might say something like, you haven't had a good scan in a while. Let's just get a full-body CT scan to make sure nothing is hiding in there. It sounds proactive. It sounds responsible. But in reality, it is often a Pandora's box that can lead to immense harm. The problem with these incredibly sensitive, high-resolution scans, like CT scans or PET scans, is that they are almost guaranteed to find something. These findings are often called incidentalomas. That's a medical term for an abnormality found, incidentally, that has nothing to do with what you were looking for. As we live longer, our bodies accumulate all sorts of benign, harmless quirks. We get small cysts on our kidneys or liver, little nodules on our lungs or adrenal glands, and thickened areas of bone. They are the human body's equivalent of barnacles on an old ship. They are simply signs of a life lived. In a 75 or 85-year-old, the overwhelming majority of these incidental findings are clinically insignificant. They would never grow, never spread, and never cause a single problem for the rest of that person's life. But once that spot or nodule shows up on a scan report, a terrible chain reaction begins. The doctor can't ignore it. It creates a medical and legal obligation to chase it down. This triggers a cascade of more tests, more scans with contrast dye that can be hard on older kidneys, and then invasive procedures like needle biopsies of the lung, liver, or kidney. Each of these follow-up procedures carries its own serious risks of bleeding, infection, or collapsed lungs. All of this is done to investigate something that was, in all likelihood, completely harmless from the start. The patient is put through weeks or months of anxiety, painful procedures, and potential complications, all stemming from a test that was done just to check. The evidence on this is shockingly clear. A study published in, you guessed it, JAMA Internal Medicine, examined this exact issue. It found that these incidental findings from imaging in elderly patients led to complications from the follow-up procedures in 23% of cases. That's nearly 1 in 4 patients being harmed by the follow-up. And the conclusion: there was zero improvement in survival. Chasing these incidental findings did not help people live longer. It only caused harm. So before you agree to any extensive scan that isn't aimed at diagnosing a specific symptom you are having, it is vital to ask why. Ask your doctor, what specific symptom or concern makes this scan absolutely necessary right now? What is the likelihood that anything we find would actually change my treatment or extend my life? And what is the risk of finding these incidentalomas that could lead to a cascade of harmful interventions? If you agree that sometimes smarter healthcare means doing less, not more, please comment the word smarter below. As we come to the close of our time together, I want us to go back to the story of Robert, the gentleman who, at 78 years old, was pushed toward a life-altering surgery for a cancer that was never a real threat to him. Today, Robert is 83 years old. He still drives himself to the lake every Thursday morning to go fishing. He spends his afternoons in the garden with his wife, and he just taught his youngest grandson how to ride a bicycle. He is living a full, vibrant, and dignified life. Not a life spent in diapers, not a life filled with the complications of a surgery he never should have had. He is living this life because he and his family were brave enough to pause. They were brave enough to ask the right questions. In the end, he didn't just choose to avoid a treatment. He chose joy. He chose dignity. He chose quality of life. His story is the heart of our message today, and it's a lesson that is beautifully simple. You are the captain of your own health ship. You truly are. And in this journey, knowledge is your most trusted compass. The information we've discussed isn't about rejecting modern medicine or defying your doctors. Not at all. It's about empowering you to be an active, wise partner in your own care. It's about ensuring that every medical decision made is one that truly adds to the quality and richness of your years, rather than taking away from them. As we wrap up, we've explored 5 critical areas where more is not always better. But knowledge is only powerful when we decide to use it. So now, I have one important question for you. What is the one commitment you are making to yourself after watching this video? It could be something as simple as, I will write these questions down and put them in my purse for my next appointment. Or maybe, I will have a heartfelt talk with my son about my wishes for my health care. Please, take a moment to share your personal commitment in the comments below. Reading your promises will inspire others in our community to take that first brave step for themselves. And if you found real value and encouragement in our time together today, please show your support by giving this video a like. It's a small click for you, but it helps this important message reach so many more people who need to hear it. To ensure you continue on this journey with us, and never miss another conversation full of life-changing wisdom, hit that subscribe button. It's more than just subscribing. It's joining a community of friends, all dedicated to living our best, wisest years together. Finally, think of one person. Just one person you love who needs to hear this message. A spouse, a sibling, a dear friend. Please, share this video with them. You might just be giving them the most precious gift of all. The gift of peace of mind. Thank you for being here with me today. Stay healthy, stay wise, and I'll see you in the next video.